10 silent pancreatic cancer warning signs most people miss. You have probably been told that pancreatic cancer gives no warning at all, that it stays completely silent until it is too late. That is not entirely true, and by the end of this video, you may never look at a few ordinary, everyday feelings in your own body the same way again. In many cases, the body starts sending small signals months before anyone ever gets a diagnosis. The trouble is, those signals rarely feel serious. They feel like tiredness, a little less appetite, a stomach that feels slightly off. This video is for general educational purposes only and is not intended to diagnose any condition or replace guidance from a qualified healthcare professional. If you are ever concerned about your health, the safest step is always to speak with a doctor who knows your history. Here is what makes this worth your full attention for the next few minutes. One of the 10 signs we are about to cover is so often ignored, even by people who see it happen right in front of them, that some doctors consider it one of the most overlooked warning signs in all of medicine. Most people do not recognize it until someone else points it out to them, and by then, weeks or even months have already quietly passed. We will get to that one later, so stay with us. Before we begin, it helps to understand something simple about where the pancreas sits and what it does. The pancreas is a long, soft organ tucked behind the stomach, deep in the upper abdomen. It has two main jobs. It produces enzymes that help digest food, and it produces hormones like insulin that help control blood sugar. Because it sits so deep in the body and is surrounded by other organs, changes inside the pancreas often do not cause obvious pain or visible symptoms right away. This is part of why early signs can be so easy to miss, and why learning to recognize them matters. This is also why the signs on this list rarely show up alone or all at once. More often, they arrive quietly, one at a time, spaced out over weeks or even months, which makes it easy for any single one of them to be explained away. A little more tiredness than usual. A shirt that fits a bit looser. A stomach that feels slightly off after dinner. None of these, by themselves, would send most people rushing to a doctor's office, and in most cases, they shouldn't. What this video hopes to offer is not alarm, but perspective. A way of noticing when a handful of small, seemingly unrelated changes might actually be connected pieces of the same larger picture. Number 1, unexplained weight loss. One of the earliest signs that doctors often ask about is weight loss that happens without trying. Not the kind of weight loss that comes from a new diet or an increase in exercise, but the kind that seems to appear on its own, quietly, over a period of weeks or months. Clothes start to feel a little looser. The number on the scale drops without explanation. For many people, this is easy to brush off, especially if they were hoping to lose a few pounds anyway. What makes this particular sign worth paying attention to is the pattern behind it. When weight loss happens without any change in eating habits or physical activity, it may be associated with changes in how the body processes nutrients or energy. In some cases, the digestive enzymes made by the pancreas are not reaching the intestines the way they should, which can affect how well the body absorbs fat and other nutrients from food. This does not mean weight loss always points to something serious. Many things can cause it, but when it happens steadily, without a clear cause, it may be worth discussing with a healthcare professional, particularly if it continues for several weeks. Consider someone like Robert, a 68-year-old retired schoolteacher who noticed his belts needed a new hole every few weeks. He assumed it was simply age catching up with his appetite. It was only after his daughter noticed how much thinner his face looked in photographs that he mentioned it to his doctor. Stories like this are common, not because people are careless, but because gradual changes in our own bodies are often the hardest ones to notice. Part of the reason unexplained weight loss deserves attention is that the body is remarkably good at compensating for small problems for a long time before anything feels obviously wrong. A person might still have a normal appetite, still enjoy their meals, and still feel generally like themselves, all while quietly losing several pounds a month. This is different from the kind of weight loss most of us are used to thinking about, which usually comes with an obvious reason attached to it. When the reason is missing, that absence itself becomes the detail worth noticing. Doctors often ask a simple but telling question during a checkup, wondering whether a patient has lost weight without trying, precisely because so many people do not think to mention it unless asked directly. Number 2, loss of appetite. Closely related to unexplained weight loss is a noticeable drop in appetite. This might show up as feeling full after only a few bites, losing interest in foods that were once enjoyable, or simply not feeling hungry at the usual times of day. For some people, this shift happens so gradually that they do not realize how much less they are eating until someone else points it out. A reduced appetite by itself is not unusual and can be caused by dozens of everyday factors, including stress, minor illness, or changes in routine. However, when a persistent loss of appetite appears alongside other changes, such as weight loss or digestive discomfort, it may be worth paying closer attention to. Appetite is closely tied to how the digestive system is functioning, and changes in the pancreas can sometimes affect the signals the body sends about hunger and fullness. It is also worth noting that loss of appetite can affect emotional well-being, not just physical health. Meals are often social moments, shared with family or friends, and when someone quietly stops looking forward to those moments, it can be an early clue that something in their body has shifted, even before they can put it into words. There is also a quieter version of this symptom that rarely gets discussed, which is a shift in food preferences rather than a total loss of hunger. Some people notice that certain foods, particularly heavier or richer meals, suddenly feel unappealing or sit uncomfortably after eating, even though those same foods were enjoyed without issue only months earlier. This kind of subtle aversion can be easy to write off as a passing phase or simply a matter of taste changing with age. Yet when paired with other symptoms on this list, it becomes part of a larger pattern worth paying attention to, rather than an isolated quirk of personal preference. Number 3, abdominal pain that radiates to the back. Perhaps one of the more commonly discussed signs is a dull, aching pain in the upper abdomen that sometimes spreads toward the back. This pain is often described as different from ordinary stomach discomfort. It tends to be persistent rather than sharp and sudden, and it may become more noticeable after eating or when lying flat. This pattern is thought to occur because of the pancreas's location deep within the abdomen, close to nerves that connect to the back. When there is irritation or pressure in that region, the discomfort does not always stay contained to the stomach area. Some people find that leaning forward, sitting up, or curling into a certain position offers a bit of relief, which is a detail that can be useful to mention to a doctor if this type of pain becomes a regular occurrence. Because abdominal pain has so many possible causes, from muscle strain to digestive issues to something as simple as poor posture, it is easy to dismiss. What tends to separate ordinary discomfort from something worth discussing with a healthcare professional is persistence. A pain that resolves in a day or two is very different from one that lingers for weeks and slowly seems to intensify. There is also a timing pattern that some people describe, noticing that the discomfort tends to worsen at night, sometimes disrupting sleep in a way that ordinary stomach upset rarely does. Others notice a connection to meals, particularly larger or richer ones, with the ache settling in an hour or two afterward and lingering far longer than typical indigestion would. None of these details, taken alone, point to any single cause. But when someone can describe a consistent pattern, rather than a vague and occasional twinge, it gives a healthcare professional far more useful information to work with during an evaluation. Number 4, yellowing of the skin or eyes. This next sign is one of the more visually recognizable ones, and it is the sign we mentioned earlier in this video, the one that is often overlooked even though it can be one of the clearest physical clues the body provides. It is called jaundice, and it refers to a yellowish tint that can appear in the skin or in the whites of the eyes. Jaundice happens when a substance called bilirubin builds up in the bloodstream. Bilirubin is a yellowish compound that is normally processed by the liver, and released into the digestive system through a small tube called the bile duct. The pancreas sits very close to this duct, and in some cases, changes in the pancreas can place pressure on it, slowing or blocking the normal flow of bile. When that happens, bilirubin can build up in the blood instead of being released properly, leading to that yellow tint in the skin and eyes. What makes jaundice so often overlooked is that it can develop gradually, sometimes so slowly that the person experiencing it does not notice the change in their own reflection. Family members or coworkers may notice it before the individual does, which is why closeness with others often plays such an important role in catching this sign early. Jaundice may also come with darker-colored urine and unusually pale, clay-colored stool, both of which are connected to the same underlying process involving bile. If you or someone close to you notices a yellow tint to the skin or eyes, it is generally recommended to seek medical attention promptly, since jaundice can have several possible causes that a healthcare professional will want to evaluate. Interestingly, jaundice is sometimes accompanied by very little pain at all, which can make it even easier to underestimate. Many people assume that a serious internal change must announce itself with obvious discomfort, so when a symptom like this appears quietly, without any accompanying pain, it can feel less urgent than it actually is. This is precisely why jaundice deserves the attention we gave it earlier in this video. It is often the most visible sign on this entire list, yet it is frequently the one that takes the longest for someone to act on, simply because it does not hurt. Number 5. Dark urine and pale, greasy stools. Building on the last point, changes in urine and stool color are closely tied to the same bile-related process just described, but they deserve their own moment of attention because they are so frequently mistaken for hydration issues or dietary changes. Dark urine, often described as looking like tea or cola, can result from excess bilirubin being filtered out through the kidneys instead of following its normal path through the digestive system. Meanwhile, stool that becomes pale, clay-colored, or unusually greasy and difficult to flush may indicate that bile and digestive enzymes are not reaching the intestines the way they normally would. Fat that is not properly broken down during digestion can pass through the digestive system largely undigested, leading to stool that looks noticeably different from what a person is used to seeing. These changes are easy to overlook, in part because most people simply do not talk about bathroom habits, even with those closest to them. Yet doctors often say that patients who mention these details, even hesitantly, provide some of the most useful diagnostic clues. If you notice a consistent pattern of darker urine paired with pale or oily stool, it may be worth bringing up during a medical visit, even if it feels like an uncomfortable topic to raise. Number 6. New onset of diabetes. Here is a sign that surprises many people, simply because diabetes is so often thought of as its own separate condition rather than something connected to other underlying changes in the body. In some cases, a new diagnosis of diabetes, particularly in someone who is older and does not have the usual risk factors such as excess weight or a family history of the condition, can be one of the earliest indicators that something else may be affecting the pancreas. This connection exists because the pancreas is responsible for producing insulin, the hormone that helps regulate blood sugar. When something disrupts the normal function of pancreatic cells, insulin production can be affected, which may lead to blood sugar levels that are harder to control, even in someone who has never had trouble with their blood sugar before. This does not mean that everyone who develops diabetes later in life has an underlying issue with their pancreas. Diabetes has many causes and is extremely common on its own. However, when it appears suddenly, without the usual risk factors, and especially when it appears alongside other symptoms discussed in this video, it may be worth mentioning to a doctor as part of a broader picture. Margaret, a 72-year-old grandmother from Ohio, had never had any blood sugar concerns in her life. When a routine checkup revealed elevated blood sugar levels, her doctor treated it as a new diabetes diagnosis at first. It was only when Margaret mentioned some additional changes, including a bit of unexplained weight loss and mild stomach discomfort, that her doctor recommended additional testing. Stories like Margaret's are a reminder that individual symptoms often make more sense when they are considered together, rather than one at a time. What often catches physicians' attention in cases like this is how difficult the blood sugar levels are to manage using standard approaches, even with appropriate medication and lifestyle changes. Diabetes that develops later in life typically responds in fairly predictable ways to treatment. When blood sugar proves unusually resistant to control, or when it appears alongside a combination of the other symptoms discussed in this video, doctors may look a little further than a standard diabetes diagnosis alone. Number 7. Nausea and vomiting. Nausea is one of the most common symptoms in medicine, which is exactly why it is so easy to overlook as part of a larger pattern. Almost everyone experiences nausea at some point, whether from something they ate, a minor stomach bug, or simple stress. On its own, nausea rarely raises concern, and in most cases it should not. However, persistent nausea, especially when paired with a general sense of digestive discomfort, difficulty finishing meals, or vomiting that occurs without an obvious cause like food poisoning or a stomach virus, can sometimes be connected to changes in how the digestive system is functioning. In some cases, if there is pressure on nearby structures in the abdomen, it can affect how easily food moves through the stomach and intestines, which may contribute to ongoing nausea. The key detail here is not the presence of nausea itself, since nearly everyone experiences it occasionally, but rather how long it lasts and whether it comes paired with other unusual changes. Nausea that lingers for weeks, especially when it appears alongside appetite changes or abdominal discomfort, is generally worth discussing with a healthcare provider rather than waiting for it to resolve on its own. Number 8. Fatigue that does not improve with rest. Fatigue is something almost everyone deals with from time to time, particularly in a world filled with long work hours, disrupted sleep, and constant responsibilities. Because it is so universal, ongoing fatigue is one of the easiest symptoms to explain away. What separates ordinary tiredness from the type of fatigue sometimes associated with underlying health changes is that it does not improve, even after a full night's sleep or a restful weekend. This kind of persistent exhaustion can be connected to several of the other signs already discussed. When the body is not absorbing nutrients properly, when blood sugar is harder to regulate, or when there are ongoing digestive changes taking place beneath the surface, the result can be a deep, lingering tiredness that feels different from normal day-to-day fatigue. Some people describe it as feeling drained even during simple, low-effort tasks, like walking to the mailbox or having a short conversation. Because fatigue is subjective and hard to measure, it is one of the symptoms most often dismissed, both by the people experiencing it and sometimes by those around them. If fatigue becomes a persistent, unusual pattern rather than an occasional feeling, and especially if it appears alongside other symptoms mentioned in this video, it may be a signal worth paying closer attention to. Many people also describe a subtle change in the quality of their fatigue, rather than simply the amount of it. Ordinary tiredness tends to lift after a good night's sleep, leaving a person feeling refreshed even if only briefly. The type of fatigue described here often does not lift in that same way. Instead, it tends to sit constantly in the background, a low hum of exhaustion that follows someone through the day regardless of how much rest they get. Recognizing that distinction, tiredness that improves with rest versus tiredness that does not, can be a genuinely useful piece of self-awareness to bring into a conversation with a doctor. Number 9. Itchy skin. This next sign often puzzles people because it does not seem, at first glance, to have anything to do with the digestive system at all. Persistent itching, sometimes affecting the entire body and sometimes concentrated on the hands and feet, can occur as a result of the same bile-related changes connected to jaundice discussed earlier. When bilirubin and other bile-related substances build up in the bloodstream instead of following their normal path through the digestive system, They can accumulate in the skin, leading to an itching sensation that does not respond well to lotions or typical skin remedies. This type of itching is often described as deep rather than surface level, and it tends to be more noticeable at night. Because itchy skin has so many everyday causes, ranging from dry weather to allergies to simple skin irritation, it is rarely the first symptom that leads someone to see a doctor. However, when it appears alongside a yellowish tint to the skin or eyes, or alongside changes in urine or stool color, it becomes a much more meaningful piece of the overall picture. Recognizing the connection between these seemingly unrelated symptoms is part of what makes early awareness so valuable. Number 10. Blood clots that appear without a clear cause. The final sign we want to cover today is one that surprises even some people working in healthcare, simply because it seems so disconnected from digestion or the pancreas at first glance. In some cases, individuals develop a blood clot, often in a deep vein of the leg, a condition sometimes called deep vein thrombosis, without any of the usual risk factors such as recent surgery, prolonged immobility, or long-distance travel. Symptoms of this kind of blood clot can include swelling, warmth, redness, or pain in one leg, often more pronounced on one side of the body than the other. While blood clots have many possible causes and are relatively common on their own, an unexplained clot, particularly one that develops without any clear reason, is sometimes investigated further by doctors as part of a broader evaluation, especially when it occurs alongside other symptoms discussed throughout this video. This connection exists because certain changes in the body can affect the way blood clots naturally, making clot formation slightly more likely in some cases. It is important to emphasize that the overwhelming majority of blood clots are related to far more common and far less serious causes, such as long flights, recent surgery, or periods of extended bed rest. However, if a clot appears without an obvious explanation, seeking prompt medical attention is always the safest choice, both because blood clots themselves can become dangerous quickly, and because doctors may want to explore whether there is an underlying reason behind it. It is worth mentioning that a blood clot is also one of the few symptoms on this list that requires urgent attention on its own, regardless of what else may or may not be happening in the body. Swelling, pain, warmth, or discoloration in one leg, especially when it develops suddenly, should never be left unaddressed while waiting to see if it improves. This is one instance where speed matters more than certainty, and reaching out for medical care right away is always the appropriate response. Taken individually, each of these 10 signs could easily be explained by something minor and temporary, and in the vast majority of cases, that is exactly what they turn out to be. Weight loss can come from stress. Fatigue can come from poor sleep. Nausea can come from something as simple as a bad meal. What matters most is not panicking over any single symptom in isolation, but paying attention to patterns, especially when several of these signs appear together or persist longer than expected. One statistic worth remembering from everything we have covered is that jaundice, the yellowing of the skin or eyes we discussed earlier, remains one of the most visually recognizable, yet frequently delayed signs, often noticed by loved ones before the person experiencing it ever notices it themselves. That single detail is a reminder of just how important it is to stay connected to the people around us, and to take gentle observations from family and friends seriously rather than brushing them aside. If there is one message to take away from this video, it is this: your body rarely stays silent. It tends to whisper long before it needs to shout, through small changes in appetite, energy, skin color, or something as simple as the color of your own urine. Learning to notice those whispers, and having the courage to bring them up with a healthcare professional, even when they feel minor or embarrassing, is one of the most powerful things you can do for your own long-term health. We would love to hear from you. Have you or someone you love ever experienced a subtle symptom that turned out to be more meaningful than expected? Share your thoughts in the comments below. We read every one of them. If you found this video helpful, consider sharing it with someone who might need to hear this today. And if you would like to see more educational videos like this one, subscribing helps us keep bringing this kind of information to those who need it most. Thank you for spending this time with us, and take care of yourself.